Good evening, everyone, and thank you for attending the Urban League of Portland's meeting, the Candidate Forum for Multnomah County Commissioner District 2. My name is JJ, and I'm a regional organizer with Welcome Home Coalition, and I will be tonight's moderator. Before we get started, I want to thank our community partners for supporting tonight's forum. Tonight, we will feature candidates running for Multnomah County Commissioner District 2. We are joined by Sam Adams, Jesse Burke, Nicholas Hara, Dr. Carlos Richard, and Shannon Singleton. Please note that all candidates running for this race were invited, but either they had a scheduling conflict, declined to participate, or didn't respond to our outreach efforts. All candidates are here to highlight their campaign proposals and answer questions related to our community. For tonight's event, we will do the opening statement and questions and closing statements. We start in alphabetical order and rotate throughout the sections. Although we hope the forum will be an exciting and informative event, we also want it to be an orderly and respectful one. All defamatory, abusive, profane, threatening, offensive, or hate speech are strictly prohibited. Candidates that engage in this behavior will be removed from the forum, period. Here are a few ground rules for the candidates. Please remain muted if you are not answering a question. This is important for audio issues as well as video focus. So we ask that you please don't forget that. Each candidate will have 1 minute for their opening statement. We ask that you deliver your opening statement. When asked questions, each candidate will have 2.5 minutes to respond with no rebuttals. After questions are complete, each candidate will have 2.5 minutes to deliver a closing statement. Please be courteous and conscientious of time and your fellow candidates. We will begin with opening statements. You will have 1 minute to introduce yourselves. We will start with Sam Adams, followed by Jesse Burke, Nicholas Hara, Dr. Carlos Richard, and Shannon Singleton. Jesse Burke, it's your time to shine.
Is it Sam's time to start? Sam Adams.
It's you first.
Okay, I'll begin. My name is Jesse Burke, and I own the Society Hotel with a location in Old Town and one in Bingen, Washington. I'm the granddaughter of a Chinese immigrant, the daughter of a man who was paralyzed when I was 6 years old. I grew up originally in Washington, D.C., and my mother cleaned houses for a living. When we were young, we were all told we had to become good at something if we wanted to get out of poverty, and our parents put us all into different sports. My sport was fencing. I did well at a young age and went on to become a member of the United States fencing team for 10 years. I'm a mother, a small business owner, and I lost a brother-in-law to an overdose in 2018. I'm trained as a teacher, focusing on high-risk children. I worked as a social worker at the Native American Youth and Family Center. I received a master's in public administration and ultimately went on to work in the private sector, owning and operating my own business. I work ground floor retail, front facing all day, every day. And I've been at work every day of the pandemic, watching things devolve. I've been endorsed by all first responders.
Thank you, Jesse. Sam Adams, it's your turn. And your time starts now.
Hi, thanks for hosting this event. And given we're heading towards the end of the academic school year and a lot of the energy behind this is the Urban League of Portland, I want to take this opportunity to thank the Urban League for 12 years ago, Midge Purcell was in one of your chairs, and together with Portland Community College, we started Future Connect scholarships. aimed at students in high school that would be first-time college students and who come from families that immediate families hadn't ever gone to college. It's now 12 years old, served about 4,000 students, majority from low-income households, majority from families of color, and we've seen an increase in the grades. We've seen an increase.
Thank you, Sam. Nicholas, it's now your turn, and your time starts now.
Awesome. Thanks for having me. My name is Nick, and I'm a fourth generation Japanese American, raising my family here in Coley. Um, I think we're in an interesting era right now, one in which Portland and Multnomah County are facing several interwoven crises. And for me, I'm very familiar with crisis, be it working with AOC during the early days of the pandemic, trying to respond and provide aid to one of the hardest hit neighborhoods in the nation, or be it working with the United Nations during famine, during war, during other types of horrible humanitarian events. And in all of these situations, I found myself thinking that crisis is really more a state of unpreparedness. I think we have a real opportunity in Multnomah County to become prepared and to move from this state of constant response to one of a just and thriving Multnomah. Thank you.
Thank you, Nick. Dr. Richard, it's your time.
Thank you so very much, Dr. Carlos Richard. Born and raised in Northeast Portland. All my lived experience is here in Northeast Portland. I have 27 years of working on the front line, serving the homeless community, serving individuals with mental health, and serving individuals who have struggles and challenges with addiction. Worked on housing issues as a former chair and commissioner with the Oregon Commission on Black Affairs. I'm a strong collaborator, strong communicator, a strong person of vision, a strong person of focus, have a doctorate in leadership. So I think I'm able to take that seat in Multnomah County District 2 because I've had a lot of experience working internally with government to help District 2 and the community solve the issues that we are currently facing. Thank you so much.
Thank you, Dr. Richard. Shannon Singleton, it's your time.
Thank you, JJ. Shannon Singleton, my pronouns are she and her, and I'm running to be Multnomah County Commissioner because, frankly, I have the frontline experience not only in supporting survivors of domestic and sexual violence, but also people experiencing homelessness and providing clinical services to folks experiencing mental health challenges. I come from the field and working on the ground in this community since 2007, but I've also served in government roles like serving as Director of Equity and Racial Justice for Governor Kate Brown. I think bringing my skills and experience to Multnomah County is exactly what we need to effect change that we're dying to see on the ground.
Thank you, Shannon. Now we will begin with the question portion of our forum. Each candidate has 2.5 minutes to respond to each question. I will call on folks when it's your turn. Question number 1. Recently, Multnomah County residents experienced climate and environmental disasters like the Kmart fire, heat waves, and ice storms. Communities of color often face disproportionate exposure to environmental hazard and pollution. How will you advocate for environmental justice policies to address these disparities? Sam Adams, it's your time.
One of the pernicious, most deadly forms of health impacts for communities of color in Multnomah County is bad and toxic air. And a lot of that comes from fireplaces, but also industrial pollution, pollutions that are emitted from vehicles like trucks. And a lot of the neighborhoods that are impacted near the sources of this kind of pollution also happen to have a significant percentage of people of color. I think what some improvements that I would make on this is, one, it has been a tradition as the local government agency, the local government focused on health to deal with air pollution. And I would definitely continue the work that's been started by previous commissioners on the County Board of Commissioners on this. And I would add to it's really important to add to the monitoring of this kind of pollution. And one thing in a previous endorsement process, they asked, what would you do to help reduce the impacts of toxic and dangerous air? And the county has put out, a year ago, put out a plan that I think had a lot of merit in terms of reducing fireplace emissions and the particulate smoke that comes from burning wood. But I would also seek to invest in more mobile air monitoring devices and not just rely on the state environmental department to do that. And I would seek to have them be on a mobile platform so that they're not currently. Now the tradition is that they sort of get cemented in one place, but as the seasons change, the need to monitor different kinds of pollution sources changes. And I think it is a smart investment for public health to have more public monitoring.
Thank you, Sam. Jesse, it's your turn. Your time starts now.
Thank you. I think one of the most helpful things is taking an initial baseline. My husband's background is actually in alternative energy contracting. And while both environmentally, but then infrastructure-wise, I think we have some opportunities at the county. One of the first, I think, is an environmental design investment. So while it's not necessarily the work that the county does in advocacy and coordination with the state and the city, that we have opportunities to change the high traffic corridors and how close they are to residential areas where there are diesel emissions. There are a significant number in North Portland, Lombard and Columbia Boulevard being two of the biggest. In addition, you can have additional investments like landscape design and adjusting how the built environment participates in improving air quality. And I think really having there are different incentives that you can offer that this isn't necessarily related to not necessarily related to external factors, but what we can proactively do is offer incentives to businesses and honestly the residents and the county buildings and assets themselves. How can we make them more energy efficient and use less currently? So it's not all housed within the county. It is a lot of advocacy, but I think that there are a lot of opportunities for coordination. Thank you.
Thank you, Jesse. Nick, it's your turn.
First of all, I'll say that I'm really excited for this question because for me, if we're not looking at really tackling climate change and environmental justice as a core pillar of how we're responding to any of the crises that we see here in Multnomah, we're not looking to the future. The heat dome that we experienced a couple years ago is not a once-in-a-lifetime event. With climate change, it's going to become more and more frequent. The ice storms that we experienced last winter put 1 in 5 homes out of power. They couldn't keep warming shelters open because Multnomah's model for keeping a warming shelter open relied on volunteers. we simply aren't thinking about climate impacts as things that we need to be investing in as a priority. So for me, I see environmental justice as part of my larger framework of justice, which is that you've got to take on a restorative model as opposed to just a punitive one. We have to think about not only the long-term lasting impacts that we've created by creating enclaves of disproportionately affected populations, either via economic or racial segregation, but we have also got to think about how are we going to restore those communities, make them whole, and build them into new and meaningful communities that are living in an environmentally just space. So the way that I would start to think about this is that we have some wonderful programs. Sam already mentioned our programs for in Multnomah for replacing your wood burning stove with heat pumps. There's great programs on that. They benefit, they prioritize communities of color. We can expand those programs in terms of infrastructure. We've had the problem of in Multnomah County, we've been underinvesting in infrastructure by about half of the fund that we need. If we were to just simply start investing at the full levels that we need, that would help with a lot of the facilities that are outdated. Right now, of the 2 libraries in District 2 that are closed, they're the 2 libraries that serve the Albina district, and there is no temporary library solution in place. So all of those populations right now.
Thank you, Nick. Dr. Richard, it's your time.
Thank you so very much. I wholeheartedly agree and concur that this is a major, major issue and has been a major, major issue for a long time here in Northeast Portland. I'm proud to work at the county in the department that houses the Energy and Weatherization Unit, who serve the community and exchange those wood stoves for heat pumps. That is some great work that they're doing. And again, if I were elected to the seat, I would definitely propose more funding to expand that program to serve more individuals in Multnomah County, especially ethnic and diverse communities. I think we also need stronger government because this issue cannot solely be addressed by the county alone. When you talk about mobile emissions, when you talk about industrial pollution, especially around transportation, those are huge. And I think the best way to address this in terms of environmental justice is form strong partnerships. And as well as forming strong partnerships, we're going to need an individual who is committed to the end. It's one thing to form the partnership. It's another thing to work in that partnership so that we can start to see some improvement. I serve on the Historic Albina Advisory Board, and we have a responsibility to provide some thought leadership with the work that's being done with I-5 and the highway covers there. And again, early on when we talked about that project, that $1 billion project, we talked about how do we bring some type of efficiency, around alternative energy. We were worried about the number of cars with the expansion of I-5 and the additional traffic that would come in. So again, for me, it's very strong partnerships with the state of Oregon, DEQ. It's very strong partnerships with the federal government. And then it's making a commitment to see those partnerships through so we can see some improvements in the air quality here that impacts so many ethnic and diverse communities. Thank you so much.
Thank you, Dr. Richard. Shannon, it's your time now.
Thank you. So I agree with a lot of what I've heard from some of my colleagues, but I'd like to give you a couple more specific examples. One, we know that Representative Nelson just successfully passed a bill to get some funds to study the CEI hub in our district that really needs to be addressed, and the risk to our community should there be any sort of potential if in an earthquake or any sort of rupture there. Additionally, I think we need to work specifically with the city of Portland to address the neighbors' concerns around the Portland International Raceway, and particularly with the leaded gasoline races that continue to occur there. Additionally, I would add that with the city of Portland, I'd love to coordinate and look at where are opportunities for investments through TCEF to address some of the heat deserts. We know most of the folks who look like us are renters in this community, and often they have prohibitions on how they're able to manage their apartments. So how are we addressing the ability to get air conditioning units into those apartments as well? I'm also currently working on all of the big infrastructure projects in our community, and I do think there's multiple opportunities for not only transit-oriented development and how are we creating walkable communities for our Black and Brown neighborhoods, but also how are we utilizing that to implement some electric infrastructure? There's opportunities with community benefits through these that we have not tapped into yet. So I think there's some things that we can do there in partnership with the state. The other partnership with the state that I would encourage us to do is really look at what has not been funded but has been requested around resilient hubs. I would like to work with the state to get funds for that and target dollars, again, to our BIPOC communities to create resilient hubs in our own neighborhoods. Thank you.
Thank you, Shannon. Question number 2. House Bill 4002 recently recriminalized drugs in Oregon, reversing certain provisions of Measure 110. House Bill 4002's success is dependent upon the creation and implementation of deflection programs. How will you minimize the impacts on communities of color? Jessie Burke, it's your time.
Thank you. Yes, I think this was a really important modification to the bill. And one of the things that I think is the most important is that we have these substance, the SHS funds that we have from Metro, that we need to be providing these within the housing that we're building. Because if we don't, then the deflection programs that are being suggested we will never have the quantity that we need, and we'll just continue with a circular system where people enter the system, maybe people are just going to die in jail or on the sidewalk, and we will never have the quantity of deflection programs available that are needed for this. We have the dollars to do this, and I think that this is incredibly important in fact, I was just on the phone today with Multnomah County District Attorney's Office with a woman who had a substance use disorder and had taken a fire extinguisher to the glass of my business. And they don't currently have a bed for her to go through treatment. So she's waiting in jail. And for many of the cases that we'll be dealing with, that is the number one need. And so I feel that the use of SHS dollars as much as possible to provide services on site where people live and to increase the number of deflection programs available is mission critical for all communities, but particularly communities of color that are struggling with addiction. Thank you.
Thank you, Jessie. Nicholas, it's your time.
Man, I wish I had something where I could say, this is going to work. The big problem that we're facing right now is that our court system currently has a backlog of over 1,500 cases that are awaiting a lawyer. The American Bar Association has estimated that we need 500 public defenders to clear out the backlog that we currently have. The House bill that we passed that recriminalized drugs and creates a deflection program is extremely expensive. If Measure 1 and 10 was poorly funded and the programs weren't implemented, which I do believe strongly was a lot of why we ended up in this space, we're going to have to radically ramp up what these programs look like as a court system. And frankly, there aren't 500 public defenders right now, even if we were to radically increase the funding available for them. So all of this is to say that we are in a bind here. We're going to have to stand up deflection programs with little to no resources in a very short amount of time while we are empowering Portland to now begin arresting folks for drug use. The idea, the hope, is that by putting them into a court system and giving them a deflection, they would be able to then move through and go to a state of recovery. What we know is that because of the difficulty and delays in the court system, having to call people back multiple times over and over and over again, it becomes harassment of the person who has become an offender without ever giving them a trial or adequate deflection, eventually putting them back through our system. I believe that the thing we need to focus on is what we've continued to focus on, or what we've struggled with, which is housing first. Housing first policies work to help reduce not only addiction, but they help to get people in spaces where they are safe and they do not need to use drugs. That's where I stand on that.
Thank you, Nick. Dr. Richard, it's your time.
Thank you so very much for the question. I think one of the things I would do with respect to minimizing the impact on ethnic and diverse communities, I think, I would want to seek out and search out providers who are also ethnic and diverse individuals to provide that service to our members in the community. Part of the problem that I see with the many years of experience that I had working for DHS and also Multnomah County in interacting and engaging with people who struggled and had challenges with substance abuse was they never really felt that they had a service provider that understood the things that they were experiencing that might have led to them struggling with substance abuse. And so I think we have to look at the framework of the providers we have. We have to look at the network of the providers that we have. I think it's a good thing with respect to, the House bill that wants to create deflection programs. But if deflection programs are not diverse, if deflection programs don't understand the various ethnicities, that the deflection programs don't understand how to provide that service to ethnic and diverse communities, I think it would lead people to continue to use drugs. And then we also have to center the individual who is experiencing the substance abuse, because most oftentimes, again, government, we think we're going to come up with the right answers. We believe we're going to come up with the right solutions, but it's better when we center equity and center the individual who is actually in the midst of a crisis. And I think we need more detox centers. I think we need to provide more funding for this in order for it to work. So again, that would be my approach and sort of my methodology with respect to, Measure 110 and the deflection programs. Thank you so much.
Thank you, Dr. Richard. Shannon, it's your turn and your time starts now.
Thank you. I want to start by saying that over 30 years in my work on the front lines with folks facing addiction, I have yet to find somebody who needs a incentive to enter treatment. What I have found, and particularly in this community, is that there is not treatment available for people when they are ready. I think if we actually want to minimize impact on communities of color, not only do we need to have that front door access for people to actually get into, whether that's detox, transitional recovery housing, we've got to get people out of transitional recovery housing and into permanent housing. I agree with Dr. Richard, we do need culturally specific providers, but we also need to be paying people so that they can live in this community. We're asking folks to do really hard work and we're paying them minimum wages. I think additionally, we have got to collect data. We have to know who is encountering, whether it's law enforcement or other folks as this is being implemented. And then we have to hold accountability on what those interactions look like. I think we know from prior data that people experiencing homelessness in particular have higher rates of interactions with law enforcement. Added to that, we have disproportionality in the BIPOC community of those experiencing homelessness. This feels like a setup for some really poor outcomes and interactions for folks of color. So we have got to collect the data and hold people accountable to that, in addition to, of course, those services on the back end. Thank you.
Thank you, Shannon. Sam, it's your turn and your time starts now.
Thank you. I think it's to reiterate some of the points made, add a few more. It is absolutely imperative, given the fact that a BIPOC community is less likely in this county to have access or be signed up for healthcare or have healthcare that provides for the kind of services that Shannon talked about. I think it's absolutely critical that we open a sobering center, that we also obviously set up the deflection programs. We need to fund more recovery options for those with current inadequate health care. We need the aftercare housing for recovery. And then again, as Shannon said, permanent housing. That is all about, significantly about, in addition to what's already been said about money. And I proposed in my race to dig into this upwards of $650 million that's been budgeted between the city of Portland and the county, home forward, look for savings, look for opportunities to redirect to these priorities that have been mentioned, that I reiterated and has been mentioned in other answers. And I also, because of the importance, again, with what Shannon said, about the transitional recovery housing and permanent housing, believe to have a more holistic system, inadequate that it might be, is that a portion of the excess dollars from the Metro SHS tax should go to that supportive housing and then the permanent housing as well. Without it, we're just sending people out the door every day. If they manage to get into the first 3 steps, out into the proverbial cold, and the recidivism rate and the death and injury rate is too darn high. Thanks.
Thank you, Sam. Question number 3. In Multnomah County, unconditional cash transfer pilots like the Multnomah Mothers Trust, which have demonstrated their effectiveness as a poverty reduction tool, were recently defunded. Do you believe that pilots such as this should be funded? If so, explain why this would be a budget priority and how you would secure funding. Nick, your time starts now.
I love these questions. These are great questions. Basic income pilots all over the United States have shown pretty unequivocally at this point that they are effective. If you look at basic income in other nations, they are effective. And they're effective because what they do is they bridge the gap that folks experience when there are sudden shocks to their system. 1 in 3 households right now in Multnomah County cannot meet their basic needs. That means they can't put food on the table, they can't pay their rent or their mortgage, they cannot keep the lights on. 1 in 2 households in Multnomah County right now cannot afford a $400 unexpected medical bill. That's basically you sprain your wrist and you get a cast for it. What we've found in basic income pilots, again, around the nation, is that they help people get through hard times. And then what they do from there, when you look at what they do with that money, is they use it to pay their bills, to buy food, and they use it to take the weight of the mental labor that they've been under, to actually go and find new jobs, find meaningful work. They are happier. They are living in a more enriching way. Uh, the fact that we, I think, have this fear of a handout is hampering us. If you look at what there was a survey done in San Francisco asking homeless folks, what would have kept you out of homelessness? And they said $5,000. That was the universal answer. Is it would have helped me pay my rent, it would have helped me get through a tough time, and I would have been in a better spot. That doesn't mean we say no to all the other supportive services that we've got, but it means that what we know is it's one of the cheapest, fastest, most productive ways of giving people opportunities, uh, where we have really just not explored that as much. So yeah, I'm all in on that. Yeah, I'll leave it there.
Thank you, Nick. Dr. Richard, it's now your turn and your time starts now.
Thank you so much. Again, I'm proud to work in the county department where the pilot for unconditional cash transfer originated from. I want to thank my colleague, Mary Lee, for her leadership and her steadfastness around the unconditional cash transfer through the Department of County Human Services. It's needed, but I think we have to work some kinks out. One, anything that is temporary cannot be effective. Because those individuals who are receiving the unconditional cash transfer are so dependent upon who's in office to make the decision to continue to fund it. So it's not effective from that perspective. If I'm elected as, commissioner for District 2, I would definitely propose that those types of pilots and projects are funded, but I want some additional things added. I want most of that money, or at least part of that money, to go to be put away for a down payment on a house. I would want some of that money to go and be put away for a children's education fund that would support kids to go to college. I would also want an individual to be assigned a case manager or a mentor who could, in effect, help these individuals increase their salary by looking for better jobs and taking on different things that they would need to do in order to increase the income into their house. I like the idea. I love the concept, but I think we need to add some things to that so that it does not look like a welfare program. So it doesn't look like it's a handout. And finally, I would like to say I would add tax. I would actually form a committee because we're talking about taxpayer dollars here. And, rather than just one entity making this decision, I think we need more community support around this decision. And if we get community support around this position, I think we'll have a better chance. Thank you so much.
Thank you, Dr. Richard. Shannon, it's now your turn and your time starts now.
Thank you, JJ. So I do support pilots. I would say this is one of those that fall in the category of we already knew this worked, so we probably didn't need a pilot and should have just set up a permanent program. We love a pilot in Oregon. We do it with rent assistance, and we know rent assistance works. So this is one that I would absolutely seek to get funding back to, and I wouldn't put the conditions that I heard just being talked about. I would like to keep it where we know that there is evidence base around this. I think one of the things we don't do a good job at is looking at our budget more broadly. When we are not giving cash transfers like this or doing rent assistance or some of these other types of programs, we are spending it somewhere else in our system because Multnomah County is the safety net. So providing these families, these mothers with funds means that they didn't need to rely on complicated bureaucratic systems to meet their basic needs. That is something I would like us to take a bigger look at. I think the same thing when we talk about our frontline workers doing these social services. Again, they're often in a position of qualifying. The county is paying for that somewhere else because we're the basic safety net. We have got to stop assuming that because this is going to be something that we give to people, that they're going to do something bad with it. That's what unconditional means, is we're trusting people in their own efficacy and expertise in their lives to do what they need to do to make ends meet. Thank you.
Thank you, Shannon. Sam, it's now your turn and your time starts now.
So my mom got pregnant in high school and was a high school dropout. I'm the third of 4 children. And just reflecting on the answers I heard and comparing it to my own lived experience, she had to, with 4 kids, had to, and then became single, struggle. $500 would have made a difference. $500 with childcare would have made a bigger difference. $500 with childcare where she didn't have to also work a part-time job to pay to get her GED and then to get a community college degree, and eventually a 4-year degree would have helped as well. As I'm interpreting Dr. Richards' comments, and maybe I'm wrong, it's customizing the individual needs of a group of families with mothers and fathers present and without, and doing that assessment and compare that to a fancy word, a group that's just getting the $500 and see what happens. I don't think we've sort of cracked the code on making it as effective as we could be. And I do think the individual needs of a group, a mother, perhaps a father, and children, should be assessed. Some things are more valuable than others. And I also found watching my mom, one of the biggest things that she had to overcome was this sense that she could do something that seemed very out of reach. And so that mentoring, which didn't exist at that time, would have been, I think, very helpful. She later in life got that and really excelled. So maybe I'm misunderstanding, but I don't think.
Thank you, Sam. Jesse, it's now your turn and your time starts now.
Yes, thank you. Yes, I do believe these should be funded. And this is a funding priority, or should be a funding priority, because I recently, as in today, read Oregon's economic ranking, and we are ranked as one of the least affordable cities in America, one of the least desirable places for businesses that pay higher wages to move to. And so until we start to reconcile some of that, I think it's pretty critical. I believe one of the best ways to secure funding is to analyze and provide a cost benefit of the longer term cost savings. To Shannon's point, it's coming from somewhere else later, so we can do this work on the front end. Last night, I hosted the first of 4 summits called the Future of Portland Summit Series, and we talked about building healthy economic ecosystems and had some an MIT PhD there who studies this, and a small business owner. And the main takeaways from the audience were that to build a healthy economic ecosystem, you need to be willing to take bold action and have bold ideas and be willing to try and innovate on anything and make small adjustments. And I think this was a bold idea. It may not be perfect, but we need to be willing to try it and make small adjustments to perfect it. There's, I think, a growing recognition that in Multnomah County and in Portland, people love process, not outcomes. And I think we need to start practicing with the outcomes. Thank you.
Thank you, Jesse. While the question number 4, while the Joint Office of Homeless Services, or JOS, has lowered barriers to entry and created a variety of shelter models, the estimated number of homeless people in Multnomah County rose over the years. If elected, how would you align the work of the county to prevent inflows into homelessness and decrease reliance on shelter services? Dr. Richard, your time starts now.
Thank you so much for the question. I mean, that honestly is a very difficult question if I understand it in terms of the flow or the influx of individuals coming into Portland and coming into the county area and the city area. I know a lot of people come here because Portland is a generous city. Oregon is a generous state. We're not going to turn people away. We're not going to put people on a bus and send them elsewhere. We're not going to send people back home. But I think, with respect to the question, I think we really need to assess what it is that we're doing in the Joint Office of Homeless Services, how we're doing it. And we need to come up with a strategy because, without a strategy and without a vision, more and more individuals are going to come and we just don't have the space. We just don't have the services in place. I think the last count I heard was that there were over 11,000 people, homeless people here in Portland. And it is a major, major struggle. So again, I think, I would bring in an outside consulting company, to work with the Joint Office of Homeless Services. To see if we can come up with some strategies, if we can come up with some efficiencies, if we can streamline some things. How are we working with our partners? How are we working with our community entities? How are we working with our culturally specific organizations? I think we need to take a look at everything that we're doing. And I think lastly, to put all this on the joint office is very, very hard. Again, we can put more money, we can put more staffing, but to solely put this on the shoulders of the Joint Office, I think is unfair. And I think we need to provide some type of help for the Joint Office of Services so that we can, really understand how to move in the area and get some shelter and get some beds for the people who are homeless.
Thank you, Dr. Richard. Shannon, it's now your turn and your time starts now.
Thank you. I do feel compelled to dispel the myth we just heard about folks from other places coming to Portland for services. We asked this question in our point in time count and have since I've been here in 2007, and the data continues to tell us that the majority of folks on our streets are from our communities or from the region. However, to the question, what I would do to address the inflow issues into homelessness is to really look at how we're doing our prevention services. Oftentimes we do one-time rent assistance, which is not helpful for a household who has ongoing financial challenges with meeting their rent and other basic human needs. I think we really need to look at opportunities to provide longer term supports to folks when they are needing rent assistance and the opportunities for economic advancement. I would like to see us connect our anti-poverty programs to our workforce development that is occurring not only with the county-owned bridge investments and the upcoming construction there, but also with the other infrastructure projects in our community. We are about to have opportunity for thousands of family waged union jobs where folks can actually afford to live in this community. We need to take advantage of that and be planning for it so we can get our folks into that. We also just talked about one opportunity around the unconditional cash program, and that is another way to really address those needs of ensuring people are able to stay in the apartments that they are living in. I think I would lastly say in our ending homelessness work, we actually don't fund a retention system. We need to start paying providers to actually provide services to people once they are housed out of homelessness and help them rebuild a community of support, look at their economic situation, and get them situated so that they aren't cycling in and out of housing and back into homelessness. Thank you.
Thank you, Shannon. Sam, it's your turn and your time starts now.
So I think the joint office has a fatal flaw, and flaws plural, I would say. For one thing, it isn't very joint when the other cities than Portland in the county haven't had a seat at the table. That's recently been rectified, but all the years that it has been in place where East County cities have not been involved meaningfully is a fatal flaw. The second fatal flaw is it is not empowered to do the kind of coordination of resources that a real joint office should have. And that's why I proposed to have that, what I referred to earlier, the $650 million between the three organizations jointly budgeted, and to look to create with the resources that we have, and $650 million divided by 11,000, you do the math. That's a fair amount of money, but it's not being spent well right now because it's being spent in a patchwork manner and has scant accountability. It's not really a system. The county refuses to acknowledge that part of the continuum, this is an example, includes the first responders that are dealing with homeless folks more than any number of outreach workers, and will continue to do so. It does not take into account willingly that cities in the county have to deal with the on-the-ground issues. It has not been a good partner. It has fatal flaws. The folks that pay the biggest price for this are those that are living outside. A joint effort, joint budgeting, joint monitoring, creating that continuum of services by the people that are empowered to work in those budgets is the way forward. Looking for opportunities to fund the sort of so-called missing teeth. We don't have enough resources for folks that want treatment, as Shannon said. We don't have enough resources to address mental health issues. We don't have enough resources for affordable housing, but we still have a lot of resources.
Thank you, Sam. Jesse, it's your turn and your time starts now.
Thank you. So I just want to be specific with what I'm talking about. So chronic homelessness, which is what we see outside, is rooted in addiction and mental health, because I know we also lump numbers together for episodic homelessness, which is living paycheck to paycheck. You lose a paycheck and you're sleeping in your car. But this one in particular, all numbers are increasing, but this one in particular, I think that the issue is that we've created an incentive-only system. So, and not everyone responds to incentives only. I sat on a Portland Business Journal panel where I was one of 3 small business owners, and the other 12 people all had lived experience with addiction. And 100% said, and I was really surprised to hear this, 100% said that prison had saved their lives, and that they wished that one of them said that the mother of their child was struggling with addiction, and he wished that she was in jail because then he knew she would be alive. And the point is not the solution to, for example, addiction is jail, but that not everyone has the ability to seek out treatment. Not everyone has, and these drugs are different. And allowing people in the name of personal choice to figure it out on their own is not compassion. So I think part of it is we've created an incentive-only system, and we do not take action proactively. I tell people, if we're serious about mental health is health, if someone was shot, you would, in the name of doing no harm, go treat them because they needed help immediately. If someone is struggling with addiction and they don't have all of their bearings with them, you should be intervening to assist. So that by itself is why I believe that there's been an increase in chronic homelessness. Thanks.
Thank you, Jesse. Nick, it's now your turn and your time starts now.
Awesome. I'd like to start with the joint office before we sort of move into, I think, the more systemic problem. The joint office right now has 19 subcontractors, none of whom pay a living wage to their frontline staff. That means that there is, on average, less than 1 year of tenure for frontline staff. They're doing this kind of work, and I think we need to be compensating them adequately. I also think that that is a huge part of why a lot of folks go through the system, and in their interactions, they don't feel like they have a personal connection to folks, because every time they go to the agency, it's somebody new. But I'd like to think about this as a larger systemic problem. When we talk about 1 in 3 households not being able to meet their basic needs, and Shannon's alluded to this, it's a big part of why people end up in homelessness. Our population has fundamentally shifted over, of homelessness has fundamentally shifted from what I think the stereotype of homelessness is. It's families, it's people just trying to make ends meet, it's people with jobs very often. And so the solution to this, uh, and that we've seen in other local models, national models, internationally, has been to go with a housing first policy. In order to do that, we need housing first. Right now, we are struggling to build enough affordable units to actually house folks and get them in a state where they can actually have a unit to live in. And the number I like to tell people, to just sort of give you that scale, is that we need 81,000 affordable housing units in the next 5 years, and we're about to build under Metro Housing Bond about 6,000 maybe. If we want to take this issue seriously, we have to go all in on a housing plan. We are not going to create the options that people need with measures that are going to cover only 1/16 of the total demand that's necessary.
Thank you, Nick. We will begin with our closing statements. You each will have 3 minutes to speak. We will start with Shannon, followed by Dr. Richard, then Nicholas, then Jesse, and then Sam. Shannon, your time starts now.
Thank you. And thank you for moderating this, JJ, and thank you, Urban League, for putting this on. I think I'm the best candidate for Multnomah County District 2, not only because of my professional experience in being on the front lines of this work for almost 30 years now, but also because of my personal experience and the work that I've had to do to move through growing up in poverty and experiencing homelessness myself. In addition to that, I have a record of results. I'm the person who was able to sit down and work with Republicans at the state to not only pass multiple eviction moratoria during the COVID pandemic, but unprecedented amounts of rent assistance to ensure that we were keeping folks inside. We also were able to pass the long-term rent assistance for youth exiting foster care, our state's first long-term rent assistance program that is really looking to address that inflow. We know way too high percentage of youth exiting the foster care system become homeless as adults. I also am the person who facilitated the compromise on the Rose Quarter project, which recently brought in $450 million for our region to design the CAP and provide that cover to reconnect the albino community. I worked with partners like Urban League to help work with Governor Brown to get the Black Cares Fund implemented. My career is just completely filled with these types of results that I can get done, and that's how I plan to show up at Multnomah County. But I ask you not to just to take my word for it. Please take the word of my endorsers, people that you've elected multiple times to represent you in District 2, like former Commissioner Loretta Smith, Representative Travis Nelson, Senators Casey Jama and Senator Lou Frederick. Take the word of the folks who work in Multnomah County and their endorsement through AFSCME or SEIU, the Building Power for Communities of Color, Color Pack, our electricians, our laborers, Next Up Action Fund. Folks in the community have loud and clear endorsed me in this race because they know I'm the candidate that can show up day one and get stuff done to ensure that we become the community that we want to be. Thank you.
Thank you, Shannon. Dr. Richard, it's now your turn and your time starts now.
Thank you so very much. I appreciate it. Thank you, JJ, for your moderating facilitation skills. Thank you, Urban League, for having us. I want to take at least 30 seconds since some of my comments were invoked and I did not have a chance to respond. It is not a myth that people come to Portland. I know a lot of homeless individuals live right here and have become homeless living in Portland, but I've been doing this work since 1997, providing and doing holistic family assessments. And so I know families have come to Portland so that they can seek a better life because the states that they live in are not generous. They are not compassionate. So they come here. And while they continue to experience homelessness, at least they're in a place where people love them and have compassion for them. Again, to the Multnomah Trust, Mothers Multnomah Trust. Again, I'm not advocating that we don't fund it. What I'm saying is we have to do two things. We have to focus on the present issue of struggling moms, dads, and parents to meet their basic needs, but we also have to build a future for the kids. So that's why I advocated for take some of the money, meet some of the initial need now, and then take part of the money and invest it so that they can secure an education for their kids and get a college education. I am the best candidate, 27 years of experience working with individuals who are homeless, working with individuals who have mental health challenges, working with individuals who have substance abuse challenges. I, like Jesse, I lost a brother to substance abuse issues in April 15, 2015. I had to eulogize my brother. So again, I understand these issues, not just from a professional perspective, but I understand these issues also from a personal perspective as well. Again, I'm a former chair and commissioner with the Oregon Commission on Black Affairs, working with the late Nick Fish, working with Brad Avakian on housing issues for immigrant and refugee families. One of the things we didn't get a chance to talk about is community safety and livability. We have small businesses who continue to struggle. We have businesses who have just left Portland by the droves and are not coming back because while we're trying to address one issue, we are failing at addressing another issue. And so again, I'm the best person to deal with this because I'm born and raised in Northeast Portland. All of my lived experience comes from Northeast Portland. Nobody knows Northeast Portland better than the person who has been here all of their life. Worked with Urban League when I was director of Successful Families 2020, providing thousands of dollars to the Urban League to continue the programs that they were doing with children. Dr. Carlos Richard is your best candidate, and I appreciate your vote. Thank you so much. JJ, I yield back to you.
Thank you, Dr. Richard. Nick, it's your turn and your time starts now.
Yeah, I think we've covered some really interesting topics, and they run the gamut of the things that I see as crises fundamentally right now that we're experiencing. We're experiencing a crisis of livability, a crisis of government trust, and the climate crisis. And those three things have swirled together into this interwoven problem that we are trying to untangle ourselves and often look at, I think, through the lens of homelessness, the most visible aspect of these crises that we see. I started this entire forum by talking about what responding to crisis was like. And it's painful, it's hard, it's a constant fog of war where you're missing information. And what I've found in my experience of working through the early days of the pandemic, working through the international crises, is that the most prepared organizations were the ones that were able to succeed and ultimately thrive. And that's what I think Multnomah has before it, an opportunity to thrive if we can be prepared. This moment is not the last moment, but the first of many. And we need to be thinking about durable solutions that are going to build our economy, that are going to create new, just opportunities for all of us, and are going to fundamentally address the systemic problems that we face today and will face in the future. For me, that's what's important. That's what I bring to the table, is not only the experience of knowing how to help teams get prepared, but the vision to move us into a future that's looking 10, 20, 30 years down the road. I believe fundamentally that we can get there and that we can have a just and thriving Multnomah.
Thank you, Nick. Jesse, it's now your turn and your time starts now.
Thank you, JJ, and thanks to the Urban League for having us today. My experience is that of a social worker, a teacher, a small business owner, and a community organizer. Working in the middle of ground zero, Old Town, I've developed policy solutions for elected officials during the greatest economic crisis in a generation, COVID-19. From cartels moving in to machine gun shootouts, this is the landscape that I work in every day. I've successfully managed over $2 million of capital projects for the city as a citizen volunteer, successfully lobbied the state legislature for $2 million carve-out to develop light manufacturing, to return to Old Town and build housing and to create jobs. Together with the skate community, I lobbied the city to secure $15 million in system development charge funds to build the Stillbird Skate Park, project 25 years in the making. I'm a trusted leader with first responders and even social workers from the county asking for my advocacy, assistance with the city, county, and state. And I have the endorsements of firefighters, police, and the deputy sheriffs who all know I understand their experience and will advocate for better tools. And I have the supportive leaders like Dr. Sharon Myron, Gresham Counselor Vince Jones-Dixon, and Vadim Mazursky. We're at an inflection point, and if we want different results, we're going to need to choose different leaders. It's time for a new generation, and I believe I represent that change. Thank you.
Thank you, Jesse. Sam, it's your turn and your time starts now.
JJ, thanks for doing a great job, and everyone else involved in making this happen. From the day one of my campaign, I've called it out and expressed what I think most Multnomahans also believe, that the problem is county government itself. And Nick's right. This is about systems, and the core system that we are running to be a member of the board of directors is deeply dysfunctional. It lacks a sense of focus, urgency. It's oftentimes a terrible partner and lacks accountability. Amazing talent resides in this terrible system, but it needs to change, and it doesn't change with wishful thinking. We all know that. And it doesn't change with only talking about the problems. It is a $3.2 billion very complex organization with over 5,000 employees, 130 different operational sites. It is going to take an amazing amount of wrestling with this bureaucracy that is very undemocratic. The county, hidden in very plain sight, has basically been ruled by one person, and that whoever is chair, who has corrupted a otherwise good government rule and has basically stifled the oversight of the elected members of the board. It is also an organization with that big budget that has no lobbying, registration, or reporting for special interests. It is so far behind in basic democracy that I'm just calling it out. Those are big changes that need to happen with the bureaucracies in order to see change on the ground, and it has to happen, both of those, in real time. I'm the only one running that has done that kind of core work at making big bureaucracies work better and deliver the services that and the programs that they are missioned to do. The Oregonian looked at this race, and I'm honored to have received their endorsement as the person with a proven record of making big change happen. I have the personal recommendations of 6 former county commissioners when the county worked better. And I would be honored to have the votes. Voters support.
Thank you, Sam. As tonight's forum comes to an end, I want to give a special thanks to our partners at LNS Captioning and Open Signal, who are airing this forum. We thank the candidates for participating tonight and our community partners. I also want to highlight the importance of voting. The deadline to register to vote for the primary election is April 30th, and the primary election day is May 21st. Democracy only works when people vote. So get registered if you aren't, and actually vote. Audience, please remember that the Urban League is a nonprofit organization that relies upon donations and membership to be able to serve our community. Join our movement for justice and equity in Oregon by visiting our website at ulpdx.org. If you are able, I invite you to donate. Your support is an investment in our Black community and our robust wraparound programming that empowers communities and changes lives. Tonight's event was a part of Urban League's series of candidate forums for the primary election. Please visit ulpdx.org/2024 primary candidate forums to learn more about this series of events. If you need assistance voting or registering during the election season, staff at Urban League are ready to talk with you. Please reach out via our website, social media, or call 503-280-2600, 503-280-2600 for assistance. On behalf of Urban League President Harmon Johnson, the Board of Directors, and all of our members, I thank our audience for joining us tonight. I am JJ, Regional Organizer with Welcome Home. Good night.